It's marketed as innovative.
Beautiful new permanent teeth in just
24 hours.
24 hours.
24 hours.
But is it just cutting corners? If this process, is so cool as it seems, why isn't everybody doing it? Our bodies don't heal in 24 hours. So is doing it this way, is that safe for the patient?
Yeah, definitely. Definitely safe.
Tell me how. Someone's coming back in 24 hours later to get their permanent teeth put in. Wouldn't that be painful?
You're putting me in the hot seat here.
I am. I'm here with Dr. Park from Nuvia, and we're here to uncover the truth about the permanent teeth and 24-hour process. You ready to dive in, Dr. Park?
Yeah, let's do it.
All right, first question. What even is permanent teeth in 24 hours? What does it mean? 24 hours after what?
Well, the short answer is you're getting your permanent teeth 24 hours after surgery. So they come in for surgery, we'll remove any remaining teeth, place maybe 4, maybe 6 implants, and then patient goes home, sleeps off anesthesia, gets in maybe a couple of good meals, comes back the next afternoon, and we have their permanent teeth ready for them.
But you also hear places doing teeth in a day. So how is that actually different from this 24-hour process?
So teeth in a day, that was designed, the techniques were created in the late 90s. And what it is you take a denture, you drill holes through it, you attach it to the implants, and you basically repair it. And so you've got all this material here. You've got this beige acrylic, you got the pink acrylic, you've got a metal cylinder, and this is attached to your implants. You go home after surgery with this prosthetic, which, in my opinion, is a disservice if you're still doing this. This is a technique that's from the 90s. These materials flex. There's a risk. It can lead to implant failure or implant complications because of that flexure, the micro movement. At Nuvia, we're not providing any teeth right after surgery. It's 24 hours after surgery. In that time, we're creating a prosthetic with some of the strongest materials we have in dentistry. We have zirconia here, and this rigid cross-arch stabilization will help with the healing process.
So at Nuvia, you're getting this permanent material 24 hours after surgery. How long is someone going to be in this with teeth in a day?
Yeah, good question. So with this temporary phase, most patients are in it about 6 months. Then they transition to a permanent material. But the first 6 months are critical for implant healing. You want something that's rigid.
Okay, but our bodies don't heal in 24 hours, unless I'm wrong. So is doing it this way, putting permanent teeth 24 hours after surgery, is that safe for the patient?
Yeah, definitely. Definitely safe.
Tell me how.
You're putting me in the hot seat here.
I am.
Well, teeth in 24 hours, it's definitely safe because we're using advanced technology and we're using the hardest materials and the strongest materials that are available to us in dentistry, and using obviously the advanced technology in dentistry to create this prosthetic. And it's been made within 24 hours after surgery. And so when you attach this to the implants, you're getting that cross-arch stabilization. You're getting that stability that's going to help with the healing process. So yes, the body does not heal in 24 hours. We completely respect the healing process. Nothing will speed up that part. But would you rather heal with something that moves and flexes versus something that's very strong and rigid? Which one's going to provide more stability and safety for those implants to heal? So let me give you an analogy. Let's say you break your bone. Would you rather heal with a sling or with a cast, something rigid?
Probably a cast.
Yeah, that's what they do in dentistry, medicine.
So when it comes to this teeth, though, is this like a one-size-fits-all? Like, is everyone getting like the same prosthetic, or?
No, that's a good question. Yeah, it's definitely customized to every single patient. Every single patient is different. Their mouth is different. Their face shape is different. So the second a patient steps into Nuvia, we're gathering information. We're digitizing all that information. We're sharing it with the lab, with the clinicians. So that way we can create a custom set of teeth for each individual.
So if this process, is so cool as it seems, why isn't everybody doing it? Why can't you go anywhere and get this same process done?
Well, first thing I would say is good luck, because it's really hard to do this. It's taken over 10 years and a lot of money to create this very efficient system, and kind of goes back to when the patient first steps into the office. All that information we're gathering, even at consult, it's being shared to our own Nuvia lab. That way they can create this prosthetic and start the process immediately. So patient doesn't even have surgery date yet, but we're already designing everything to create this prosthetic ready for them for after their surgery.
So what is happening at the lab? Can you get a little more specific there?
Yeah, so the lab, they're essentially working around the clock, 24 hours a day, creating the teeth. And so there's a lot of communication between the clinicians and the lab. They're taking the information that we're gathering, photos, digital imagery, all that stuff is shared with them. And, it's just a process of digitally designing, milling, and, fine-tuning the prosthetic so it's ready for them after surgery.
Okay. Well, with, all this technology and getting it done super quickly, I would imagine this would be super expensive. So what do you have to say to that?
I would say no, it's not more expensive. It's a huge misconception. It's definitely below the national average. And so Nuvia has just created this very efficient system, and they've been able to pass the savings on to the patients.
Okay, so how does somebody find out how much this process does cost?
I believe Nuvia has a cost guide, and I think we can put it in the description below, and they can take a look and see if this is something that works for them.
I am curious about the patient experience, because this is not like going and getting your nails done, right? Like, this is surgery. So is someone awake during this process? How does that usually work?
Definitely not. We make sure that patients are asleep, very comfortable before we even begin. So we definitely have a big team during surgery to make sure that the patient is always comfortable throughout the process.
So what does that team look like? Because I've seen places that they'll have one person be doing it all, giving the anesthesia and pulling the teeth, and that's not what it looks like?
Yeah. So, in some places you can definitely be the provider that does the surgery and provides the anesthesia. But to me, that is very difficult, because when you're administering anesthesia, you need to be watching your patient's vitals, making sure they're comfortable, but also you're doing the surgery. And so at Nuvia, we have teams that are separated into their own area, where the surgeon can just focus on the surgery. And we have nurse anesthesiologists that administer the anesthesia and watch the vitals, make sure the patient is comfortable throughout the process. You also have the restorative doctor in there taking a look, making sure everything looks good from a prosthetic point of view, making sure the implants are placed in the correct location, and everything looks good so that the teeth will match with the surgery itself. And then obviously it's always good to have a second set of eyes during surgery and throughout the whole process.
Why is that?
Well, the only analogy I can think of is, let's say you're at a restaurant. The person that's serving your meal isn't the one going back and making your meal, making your steak, making your sides. There's usually, you go to a Michelin restaurant, you have a sous chef, you have pastry chef, you have the main chef, you have people that are specifically on their station. And so that's the same thing that we have here at Nuvia. It's a complex surgery. It's over 2 hours long. And so you want to make sure that in those 2 hours, each person involved in the surgery is hyper-focused on one specific role. So you want to make sure that oral surgeon is hyper-focused for those 2 full hours on this surgery and on this patient for safety. And then you have our nurse anesthesiologist hyper-focused on watching the vitals, making sure patient is very comfortable throughout the process. And you have dental assistants, assisting surgeon, assisting CRNA, and assisting the restorative doctor, so that everybody is a part of this process Very complex process, but coming together for one reason and for the patient.
Okay. All right. Well, that makes sense. And surgery for the patient, you said they're asleep, right? So they're not going to be in pain. But let's talk about after. Someone's coming back in 24 hours later to get their permanent teeth put in. Wouldn't that be painful?
No, that's a good question. I mean, that's a big question that patients ask before surgery. I would say pain is a little subjective. Every patient is a little different. People may have higher pain tolerance. Others may not. I would say 90% of the patients are able to get through the pain the first week with just ibuprofen. But we obviously can provide additional pain meds as needed for patients that may, need more relief.
But what about when like the swelling goes down? You're still have that same teeth in your mouth, right? So wouldn't this like gap form or how does that work?
Yeah, I mean, a lot of competitors, they hyper focused on, you're getting teeth in 24 hours. Oh, they're not, they're not addressing the big issue, the gap. What about the gap? The gap we address, we definitely do. And with the materials that we use, it's very tissue friendly. And so in my experience, I've worked with both prosthetics and the materials that are touching the tissue with teeth in a day are very noxious. They're very toxic to tissue. Here at Nuvia, we use materials that are non-reactive, zirconia and other materials that are non-reactive to the tissue. And so I've seen less gaps. But yes, gaps do develop. That's not a problem. Actually helps with the healing process because you can get in there with super floss, the water pick, your toothbrush, because you want to make sure that during the healing process, you are respecting the healing process, you're respecting the tissue, you're keeping it nice and clean. The better you keep it clean, the better it is, obviously, in the long run. You can't own a car and never take it in for an oil change. Otherwise, it's just going to break down. So definitely still need to make sure you keep everything nice and clean. And that gap, we do address it. We see the patient at the 4-month mark.
Okay.
And if there is a gap, we do address it.
Okay. Well, you said 4 months for the healing process. It can vary. How long does it take for someone to maybe go back to work though? Like, are they down for 4 months as well?
Mm-hmm. Yeah. I mean, if you're sitting at a desk for most of the day and you're not doing a lot of speaking, we've seen patients go back to work within 2-3 days.
Oh, wow. Okay.
Not a big problem. If you're doing a lot of public speaking and stuff like that, I would say give it a little more extended period of healing process, maybe 5-7 days, so that you get used to that prosthetic. So
you mentioned maintenance earlier. I'm curious, how hard are these to maintain, maybe compared to like regular teeth?
Mm-hmm. Well, maintaining regular teeth, it's very difficult. I mean, we have natural teeth, and so every individual tooth needs to be brushed, needs to be flossed, needs to be kept clean. Otherwise, you're going to get cavities, you're going to get periodontal disease and stuff like that. With this prosthetic, you definitely still need to maintain it. Like a car, you cannot not change the oil and expect it to run forever. So you need to water pick. A water pick is basically power washing the prosthetic and the tissue. You need to brush the teeth and the tissue still. Not as obviously aggressive as natural teeth, but you just want to keep it clean. You don't want any plaque on it because the plaque will still develop into calculus. So the toothbrush is still a part of your repertoire in terms of oral hygiene. The toothbrush also helps kind of stimulate the tissue and keeps the tissue nice and firm and snug to the prosthetic. And Superfloss. Superfloss is always going to be the number one thing that you want to use with cleaning this prosthetic. And you want to scrub the prosthetic, and then you also want to scrub the tissue and keep everything nice and clean, nice and pristine. That way you don't have any issues with the prosthetic or with the implants.
Well, that brings me to, how often do these things fail? How often do dental implants fail?
So Dental implants overall, there is a failure rate of maybe 5 to 10% across the board for single implants, for prosthetic implants, everything like that. With Nuvia, it's less than 1%. So implant success rate is over 99%.
And why do you think there is such a low failure rate with Nuvia?
I think it goes back to the materials and the technology that we're using. So kind of going back in the history lessons of the All-on-X in the 90s, this flexes. And so if you're allowed to heal without movement, you're going to have less complications.
And you said you've worked with both processes. So can you maybe talk about what you saw working with this like traditional dental implant method? Like, were you having to repair a lot or?
How much time do you have? Because it's going to take forever to talk about this prosthetic. This prosthetic is great. It was great when the technology and the techniques were designed in the late 90s. But in my opinion, this is a disservice for all patients these days because we've had a huge boom in technology in dentistry.
So how long are these things supposed to last anyways?
I mean, I think the goal obviously is to make sure that these can last the rest of your life. But it's very important that you comply with the oral hygiene, keeping things super clean, and just using common sense. So sometimes patients have weird habits, maybe chewing on utensils or fingernails. We had some fishermen, they bite on the fishing line, and stuff like that. You just have to kind of manage your behaviors as well and baby this as much as possible. That way it can last forever.
So again, you've done both of these processes. From your perspective, what do you think the biggest benefit is for doing it the 24-hour way?
I mean, that's a huge question. And the only answer that comes to mind is it's patient focused for me. So when I used to do this prosthetic, teeth in a day prosthetic, it was great. It was good. Patients get their teeth immediately. But now they're in these kind of temporary phase for 6-10 months. And so there's that transition period for 6 to 8 to 10 months where they're in these teeth. And so it can be a little bit fatiguing for the patient. And then by the time they get their final teeth, it's a happy moment, but the patient's been through so much that it's a little bit muted. I think with Nuvia, what I've definitely noticed is when we're able to reveal their smile 24 hours after surgery, and these are their final teeth, their final smile, it's just life-changing. You can tell their personalities completely change. They may have come in to consult very quiet, kind of a wallflower. But once you get them into their permanent teeth, they're smiling, they're laughing, they're able to socialize more and just allow their personality to come out. And we just have these amazing patients that come in and they're just super quiet. And then they get their teeth and they're just amazing individuals that have a lot to say, love smiling, giving hugs to everybody at every appointment. So that's the difference.
Well, Dr. Park, it seems like this process is not too good to be true.
It's definitely not. I think it's misunderstood just because there's a lot of misinformation online and people just don't understand that Nuvia is taking all the advanced technology possible and continuing to take advanced technology and putting it into their systems and always trying to change it and make it so that we can provide, the best treatment for our patients.
My last question is everyone a candidate for this?
Unfortunately not. I wish everybody was, but it's very important that you take that first step, take that 60-second quiz to see maybe if you could be a candidate. And then don't be afraid. Come in to consult, meet the doctors, meet the team. We'll take a scan and we'll just talk to you and tell you what your journey looks like. And if we're not able to provide this prosthetic for you, we'll definitely give you information on what your journey may look like and maybe direct you to a provider that can provide you with, some kind of treatment.